We probably should go ahead and get started. And I want to thank everyone for joining us today for Children's Health in Focus, conversations we are having with experts in the field on timely and health-related topics. I'm Arturo Brito, President and CEO of Children's Health Fund. I rejoined the fund in September 2021, though I have a long history with CHF. For more than a decade, I served as the medical director of the South Florida Children's Health Project, one of our partnering programs. Today's topic is the profound effects of adverse childhood experiences. Before we get into the topic, just a little bit of background on Children's Health Fund. If you go to the next slide, Mahul, please. We were established 36 years ago, 1987. Our vision is to ensure that all children receive the health care they deserve and need to thrive and succeed. We lead a national network to bring comprehensive health care to children growing up in under-resourced communities, and we advocate for the health and well-being of all children. Today, our national network includes 25 programs in 15 states, DC, and Puerto Rico. Our partners provide comprehensive health care to children and families in some of the most hard-to-reach areas across the country, from urban to rural. Our partners deliver services to children where they live, play, and learn through a fleet of more than 50 mobile medical clinics and at more than 400 school sites, community sites, and homeless shelters throughout the country. Simply stated, adverse childhood experiences are stressful or traumatic events that occur before the age of 18. The landmark Centers for Disease Control and Prevention and Kaiser Permanente study, published in 1998, evaluated 10 discrete events, which you can see here on this slide at the top of the tree. They included psychological or physical abuse, or living in a household where someone had mental illness or had been imprisoned, and defined them as adverse childhood experiences. This goes back to 1998. More than 2 decades of research since, however, we have expanded our understanding of ACEs. Systemic stresses on the community and the community environment, such as poverty and racism, can function much like the originally defined ACEs. We call this adverse community environments. So it's really important to understand that adverse community environments and adverse childhood experiences, when unaddressed, can lead to lifelong health problems, mental and physical. In fact, 7 of the 10 leading causes of death in the United States are linked to ACEs. ACEs also negatively impact education, job opportunities, and lifelong earning potential. Equally important is that ACEs can be prevented and they can be managed when they do occur. Before I introduce our special guests, I'd like to encourage everyone listening to please put questions in the QA function that you see at the bottom of the screen. We'll try to get to as many as possible during this short half hour. But we do encourage you to ask questions through that, not the chat function, but the Q&A function. So I am honored that today we are joined by Mr. Dave Ellis and Dr. Jeffrey Holzberg. Mr. Ellis is nationally recognized for facilitating conversations around toxic stress in the lives of young children particularly, and for leading training programs across the country around ACEs. Dave most recently served as the first executive director of the New Jersey Office of Resilience. The office was created in 2020 to host, coordinate, and facilitate statewide initiatives at the Department of Children and Families. Dave and I worked together on these efforts when I served as the executive director of the Nicholson Foundation, a New Jersey-based family foundation best known for its efforts to improve health and early childhood systems. Under Dave's leadership, New Jersey became nationally known as on the topic of ACEs and childhood resilience. We're also honored today to be joined by Dr. Jeffrey Holzberg, a community pediatrician and early childhood advocate and director of clinical research at Chiricahua Community Health Centers, one of CHF's 12 partnering programs. The Southern Arizona Children's Health Project is one of our programs that we partner with. It serves children and families living in Cochise County, a rural and very remote part of the country. CHF's Research Accelerator cohort on ACEs is led by Dr. Jeffrey Holzberg. He co-founded also First Three, an early childhood initiative to bring the neuroscience of early childhood development into the lives of families and children. So with that, I want to welcome you both, Dave and Jeff, for joining today. And we're ready to get going with the conversation. So Dave, I'm going to kick it off with you. Can you say a little bit about and elaborate on how common are ACEs?
First of all, thank you for the invitation, Arturo. This thing called ACEs, Adverse Childhood Experiences, I think when originally folks started looking at the data, I think folks thought that it only existed in specific areas, and I think they were surprised to find just how common these things are. The original ACE study, the data that was presented, 33% of those folks, and realize this study, over 17,000 people, 33% of them had 0 ACEs. And what does that say about the rest of us, right? 67%, 2/3 of all of the rest of us have at least one adverse childhood experience. And even beyond that, what we know is that 82% of the time where you find one adverse childhood experience, you'll find another. Okay, so they really do not occur in a singularity. When people ask me, well, how do you know this? I used to work in the field of domestic violence. And one of the original ACEs was domestic abuse. But I never saw a domestic abuse case where there wasn't some type of chemical abuse or some type of neglect or some type of other types of abuse within that. So in most cases, they do not show up as just one thing.
Thanks, Dave. You know, when I was introducing, I talked about toxic stress, and I know this is something that Jeff has worked quite a bit on, and there's sometimes confusion about toxic stress and how it relates to ACEs. So maybe, Jeff, if you can say a little bit about that and help us understand what toxic stress really is and how it relates to ACEs.
Yeah, for sure. Yeah, thanks, Arturo. When we talk about ACEs, we need to talk about toxic stress. And what is essential to understand about the story of toxic stress, or really the story of any stress at all, is that our body communicates that story. And so what does that mean? Our body communicates the story of toxic stress and of ACEs. When an adverse childhood experience occurs, so let's say alcohol abuse in a parent, that experience for the child causes the child to have a high level of stress in their body for a long period of time without a supportive caregiver there to help them process and cope with that stress. And when that stress is sustained and it's high enough in the body, it can really cause harm to the body and to the brain. And it can really lead to serious behavior issues and lifelong health problems. And if this happens when the child's particularly young, like let's say in the first 5 years of their life, it can have really immense impacts on the development of their brain, the development of their organs. And so this is the body's response to toxic stress. And when we look at a child's behavior and health problems, it's actually what we're looking at is the body's communication of that story of stress. And if there are multiple ACEs, as Dave mentioned, or multiple triggers, it can really have a cumulative toll on a person's physical and mental health that lasts a lifetime, really.
Yeah, and I touched on that a little bit, but you know what most impressed me about the original study, Jeff and Dave, is when I first read the findings of it, wasn't that emotional or mental health, the impact that ACEs had on that. That was kind of predictable. However, independent of that, it did have a impact on physical health. And I touched on that a little bit in the opening comments, but maybe Dave, you can say a little more about the consequences of ACEs, whether it's on the health side or on the socioeconomic side. I know you've worked with a lot of people around this, so maybe say a little bit about that. And Jeff, I'm going to come back to you a little bit later because, we want to leave this conversation with what can we do about this? So, but let's start first understanding the consequences a little deeper here, Dave.
So as you start to think about this, the original 10 ACEs that were studied, they're not the only ones. I want to point that out quite quickly here. And all of these things begin to have an impact. When you think about homelessness, when you think about food insecurity, bullying, there are a number of things that enter into this. But as what we know is that the more of these things you start to accumulate, the more likely you are to have some type of an adverse health problem, right? And so as we start to think about the things that have been attributed to ACEs up to this point, you're talking about anything from obesity, which in this country is one of the leading indicators. We are at the precipice of becoming the most obese country, if not already, in the world. The idea of looking at our ability to just hold a job, it begins to impact whether or not we can go to work. And if you can think of someone who has a lot of trauma in their life, it can impact them 25, 30, and entire months at a time, right? And so this idea of that we always come up with a pull yourself up by your bootstraps and let us, make this better. You're talking about folks who may not have an opportunity to do that because their biology has now been altered by the stress itself, and they don't have the ability to do those things.
Thank you for that explanation, Dave. Jeff, I'm going to come back to you then about maybe you can share, as you explain, maybe what can be done about a story from your practice on your experience as a pediatrician who really focuses and understands early childhood development.
Yes, for sure. I could share the story of a brother and a sister who I see frequently, and it really represents a lot of the kids I see in clinic. I work in a pediatric clinic in Arizona, and the last time I saw this brother-sister pair was a couple months ago, but it's been years since I first met them. And I first met them for a general checkup, a physical with their mother. And during that first visit with them, when I asked the mother what was most troubling for her, she reported anger issues immediately. And it sounds like both kids would have behaviors of large, violent anger outbursts at every little thing, whether it was they couldn't eat dessert until they ate their vegetables, or they needed to put away their PlayStation. They would scream and yell, and the mother said they would sometimes hit her, and they really had a lot of difficulty hearing the word no. And this was also true outside the home. They weren't working yet, but certainly in school, they struggled in school with grades. And these were the kids who interrupted teachers, distracted other classmates, showed up late. And as mentioned, their health also suffered. They were dealing with worsening obesity and prediabetes. And when I asked mom what there was that she could do, she said, I have no idea. They never listened. And so then I spoke with the mother alone. And asked about early childhood. And this is when I quickly became clear that they had a lot of exposures to toxic stress from a young age. The parents were currently separated, so that's one ACE. But in their early years, the father was a drug addict, and he abused and sold drugs from the house. So that's the second ACE. And then when on drugs, he would hit himself, and he would actually emotionally abuse the family. So it's a third ACE. And eventually he was convicted and sent to jail, and that's a fourth ACE. And this led to some real issues, mom said, in their finances and paying the bills. So it's 5 ACEs. And so we know that just having one ACE can have an increased risk of mental and physical issues, but 5 is a lot, and it's cumulative. And so it really started to put together the picture of how ACEs early on and toxic stress can have effects on all realms of behavior and health, and thus began the work of supporting the mother and her children sort of through those ACEs.
That's very helpful and makes it very concrete and easy to understand, Jeff. Dave, I was going to ask you a separate question, but there's a question in the Q&A And again, I'm going to encourage people to put their questions there, not in the chat. We're monitoring the Q&A function here. More that talks about a parenting education program. It's not defined. And ask the question about, should public health be doing more of this parenting education around ACEs? If I understand the question correctly, and I know you know a bit about this and have done some work around this, can you say a little bit about your experiences, whether New Jersey or elsewhere, around parenting education around ACEs and what effect that has had or may have?
You know, Arturo, the issues that we are talking about here are not new. So all of the things that we're talking about have been happening for centuries. The thing is, as I talk with people, and as I did it in New Jersey and Minnesota, whether I was in California, it didn't really matter. The same thing always seemed to happen. I would ask people, are you pleased with the outcomes that you're having? And the answer was no. The only thing that I have found when I talk with people that we have not done yet is to include the parents directly in this conversation at all levels. And by all levels, I'm talking about decision-making levels, right? Not just to come in and be a patient, not just to come in and give you information, not just be a client in a nonprofit, but to really be at the table. And so what we have discovered is that when we open the doors to the parents, should there be a new paradigm? I think parents should get this information. How we deliver it may be a different story depending on where you're at. Okay, I do trainings all over the country, and one of the things I try to impress upon people is the need to make sure that parents and young people are in all of our conversations, that's where we need to be listening to. And if you're looking for innovation, that's where you're going to truly find it, is by partnering with those folks in the field who live with it every day and have figured out how to live with it. There's a specific program that I was working with in New Jersey called Positive Deviance. And it looks at those people who have had trauma in their lives and still, because the thing to point out is trauma is not your destiny, okay? But these folks have actually proven now, regardless, yes, these things happen to me and I still succeed. And what is it that drives that? Is giving them the ability to participate in their own healing in this process.
Yeah, a couple things here that really resonate is that, and I think worth repeating, trauma is not your destiny. And I think that's really important to understand that even when they do occur, when you address ACEs, things get better, right? And the other piece of this is that as a community pediatrician, and I know Dr. Holzberg is going to agree with this, is that we don't necessarily have the answers. The answers come within the community with people that are living in those communities, and we need to be listening to them. And I know you do that very well. I know Jeff does that too as a pediatrician. So I thank you for that. And I think it's time we did more of the listening to the community, because the solutions are within the community, even the most under-resourced communities. So Jeff, I've been to your community health centers. I've visited the mobile clinics that you and others there work off of. I know what it's like at the Southern Arizona Children's Health Project. I know what it's like in Cochise County. When you're describing that story, though, I worry that audience members don't quite understand the kind of partners we have in our network. And as in one example, I would like you to say a little bit more about the kind of the topography and geography of your community, the populations that you serve in that community, and then the challenges that you have, but how you're able to overcome those challenges in spite of the remoteness of Cochise County and the communities you serve within it.
For sure, yeah. I work with a federally qualified health center, which is essentially a community health clinic. And we have sites all over our county, and we're in Southeast Arizona. I work actually in Douglas, Arizona. And our county is on the US-Mexico border. So to our south, we have 100 miles of the US-Mexico border. And in Douglas, where I work, it's right on the US-Mexico border. And certainly our patient population reflects that. I would say 90% of my patients at least are Mexican or Mexican-American, and many of them live on the Mexican in Mexico, and then cross every day to go to school, and because they're citizens and have family and on both sides. It is really one large community. And on top of that, I think it's a really unique population living on the US-Mexico border. Arturo, you brought up that tree at the beginning. And I think, and Dave's mentioned this as well, on top of trauma that sort of occurs inside homes and within families, the community I live in on the US-Mexico border is a community that has dealt with community level trauma for years. And this is driven home through very negative media, policies, and legislation that portray Mexicans, Mexican Americans, and just immigrants in general as threatening and dangerous. Just on Tuesday of this week, a new announcement was made from the White House that immigrants seeking asylum who cross the border without documentation will be ineligible for asylum status. And so, regardless of what you think about border policies, the policy and media coverage of this causes trauma within the community through portraying a group of people like immigrants or Mexican Americans as dangerous, as wrong, as unlawful. And this can really have a significant effect on the toxic stress of the individuals who are carrying them. And so it's in that sort of light that we work every day with these families who have built incredible stories out of overcoming a lot of that trauma.
Yeah, and I can't help but notice in the chat function that somebody commented that you're a gift to the community there, Dr. Holzberg, and I would agree. I think what I'm trying to impress upon people is that we partner throughout the country with providers like yourself who choose to move to communities that are very under-resourced, and that's where you dedicate your professional life to, and we appreciate it. And you just described also how we talk about the adverse community environment and how that is an ACE itself, some would consider, if not originally defined in 1998, but as we understand more, certainly is going to impact the mental health and physical health of children, and not just at the moment as they grow up and develop, because of the way we understand and how you describe how those stressful factors impact the changing body. So thank you for being there. And Dave, you're also getting a lot of comments in the chat function about what you do. Maybe you can say a little bit more and what you've done over the years, say a little bit more about some of the successes you've had in other states like New Jersey, Minnesota, or wherever else you've worked, because I can tell others here that in this 2 short years that you were in New Jersey helping us with the ACEs issues that we had there, like we do in other parts of the country, you really did raise the state to the national spotlight on work around this in 2 short years. So can you say a little bit more about some of those, what worked best for you, and maybe what things would you like to see improved?
The work, Arturo, is something I keep telling folks. I don't know what I'd be doing if I wasn't doing this, right? And what I've discovered is that success looks different depending on the things that you're working on. For me, doing presentations and having that person come up to me after the presentation that says, you know what, I've heard this 6 or 7 times, and it's the first time I don't feel crazy, right? To me, that's one level of success. That's the one that feeds my soul. The other piece is about how do we figure out how to move this information deeper into community, right? So how do we create awareness? So training and bringing trainings into communities. Jeff, you will have me as another ally soon. We're building in Cochise County, and with any luck, we'll be in within the year. So I'm looking forward to joining you in the work here in Arizona. The ability to take this work and literally infuse it into communities in a way that the community is now responsible for it, as opposed to systems, which was the real design that we implemented in New Jersey. And quite frankly, what we implemented in Minnesota, which for those who are not familiar, a lot of the trainings and work around ACEs began in Minnesota probably 10, 12, 15 years ago. I was one of those original people. Since then, Minnesota has trained over 400 people to do presentations across the state. New Jersey now has its own cadre of trainers that go out and train in the community and train in nonprofits. The foundations have bought into this. The governor's, the First Lady's initiative around maternal child health is another piece of that wheel. These are all things that come out of doing this ACEs work. And if I keep going, I'll be talking for days because there's a lot of stuff.
So Dave, along those lines, I want to there's two questions in the Q&A function that I want to get to. One is related to this, is along this, the through line that you're talking about here, is what are strategies, and maybe you keep this brief because I'm moving to Jeff with another question about in utero stress. But what are the strategies, if you could just define it, one or two strategies that are used, and in the words used by the person answering the question, people that are oppressed, or people that are, the way I would look at it, not only lacking resources in their communities, but also beaten down, basically.
Yeah. Well, first of all, let me say there is no silver bullet. Everyone wants to know what's the one thing. And my wife is really clear, there is no silver bullet. There's only silver buckshot. Okay. So the question is, what are the pieces around the buckshot? We know that that working around things like individual capabilities, there are core protective systems that we can bring into play to help offset those things. That looking at what are the positive experiences that a child can have. Right. These messages that we're trying to give people are messages of hope. They are not negative messages. So there are positive things, just like adverse childhood experiences. There are positive childhood experiences that we can begin to utilize to impact. I often talk with people about circle processes because it gives a child a way to calm, right? To sit in a circle, actually begin to feel. And people say, well, kids can't sit in a circle and be quiet. Yes, they can. We just have to ask them to. I think we've come to a point where we don't believe our children really have the skills that they do have. I know that having a caring and competent adult involved in people's lives, we always say caring, don't forget the competency. It's not just about love. There's a lot of other things that can be done. You can go online, if you really want to go do something, Google some of the leaders in this field that actually go out and do this day to day. Look at what Bessel van der Kolk has to say about all of the different things that you can do. These things don't cost money, not really in the scheme of things. And so it's about figuring out how we deal with that. And I better leave some time for Jeff, so go for it.
Yeah, so Jeff, in a minute or less, can you say something about what we know about in utero stress?
Yes, and let me just say one other thing about what Dave mentioned, which is that the incredible change makers that we see around us, the people who are really shaking up things and really creating change in our communities, are people who have experienced trauma and have overcome it. And because trauma unravels, and in a supportive, loving, caregiving relationship, it can be re-raveled in a way that speaks true to who that person really is. And I think we are all experts of our own story, and how do you capture the wisdom of people who have been impressed is helping them to tell their story can be incredibly healing and informative. And in utero stress, we know 26% of brain development happens in utero. Those neuronal connections are made. Growing as a fetus is naturally very stressful for the fetus. Stress is not necessarily bad. I think prolonged levels of high stress, such as the ACEs, can have detrimental effects, but stress is a part of life. In utero stress is a part of being a fetus. And I think if it's handled in a way that is nurturing and loving, can really be overcome.
Yeah, thank you so much for that answer. And unfortunately, we're out of time. So I want to thank you and Dave for participating and be part of this conversation. I want to thank everyone in the audience for participating, for your comments and questions. Really appreciate it. Please know that through our listserv, we'll be sending a summary email of today's conversation. In that email, you'll find some resources to learn more about this very important topic. We hope you'll reach out to talk to us about how you can get involved and support this work. And we hope that you'll be able to join us on our next Children's Health in Focus, the end of the COVID-19 public health emergency, implications to under-resourced communities. Here, we're going to discuss how access to healthcare will be jeopardized for some populations. Be on the lookout for the invitation. And again, I thank you all for joining today. And Dave and Jeff, man, we could continue this conversation forever. And we'll continue it offline and maybe revisit this at some point in the future. Thank you.